Hello, everyone. Welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. And if you've been following us, you know that we've been going a lot deeper, going deeper and deeper into cardiovascular disease and why we as Nigerians need to pay special attention to it. Because the way the trends are going is only going to get worse. And 80%. This is a statistic now. 80% of all deaths from cardiovascular disorders, especially strokes and heart attacks, will be happening or have been happening in developing countries. Not developed countries, but developing countries. And it's easy to understand why. Because when someone has a heart attack, when someone has a stroke, there's a very short window period in which you can really reverse things or to delay the damage that has been done. So you need in fact, that window is about 6 hours, especially for strokes, in which the doctors can intervene and get the greatest benefit from their intervention. But if you leave it for 7, 8, 9, 10, 12, 24 hours, not much can be done. And as you know, in our environment, the ambulance services are not optimal. Let's put it that way. So many times people have to find their way to the hospital. And if you don't know a stroke is happening, if you don't know a heart attack is happening, you may not be too quick to go to the hospital. So it's very important. Again, this is why we're doing this show on with NTA. It's very important that you pay attention to the fundamentals, the rudimentary principles that govern heart disease, that govern the flow of blood from your heart to the rest of the body, especially the brain, so that you can do what it takes. You can avoid certain things, you can do certain things to ensure that your cardiovascular health is preserved well into your 70s and 80s. And that's what we're doing with this show. So thank you for staying with us. And today we're going to be talking about a very, very special topic, one that is, well, shall we say, near and dear to my heart. And what topic is that? The woman question. You may be wondering, what does that mean? Okay, well, we're going to go into it. Now, in front of your screen, you see about 10 things that talk about what increases the risk of blockage to the blood flow. So let's go back to the board. Blood flows from here to here. All right. As we go along, as you get older and older and older, this places begin to get, what was the word again? Jaga jaga. And these things begin to fill up. And so eventually it can actually cause blockage. But for most people, thankfully, this doesn't happen. Complete blockage doesn't happen, but your blood flow can be impeded by all these things that are in the lining of the blood vessel. It may just show as fatigue. It may just show as maybe you're getting more infections because the blood flow is not adequate. Now, like I said, we've listed quite a few things that can cause this blockage of blood vessels. We want to talk about why women are more prone to heart attacks and strokes, or why women die more. And I take you to this statistic. You're going to see it on the board. It says that, on your screen, it says that 48%, there are more deaths from heart attacks and strokes in black women than black men. And in addition, as we all know, black people have more deaths from heart attacks and strokes than white people do. So it's like a dummy whammy. Being black and being a woman are two combining factors that make you more susceptible. So you need to pay special attention to it. And in the US, the women are rising up, especially the white women, and they're saying, hey, listen, we women are actually being marginalized, because they looked at all the research, they look at all the treatment, and they say, well, listen, the woman's disease is much, much worse. And they're like, what is going on? And and some of the things that they pointed to were that the medication that is being prepared or being made for things like hypertension are made specifically with white men by white men and for white men in mind. So you have the researchers being white men, the subjects being white men, and then the medication, the manufacturers being white men, and everything there. And this is their contention. The doctors in the U.S., the women doctors, are saying that they're not really focusing on us as much, and so the medication isn't working as well. They're finding out that even as much as 80% of side effects are found among women, because they didn't test these drugs on women as much as they should have. And so it's mainly on white men, and the assumption was that, well, if it works with men, it can work with women. If it works on white men, it can work with black men and women as well. And that is not true. They're finding out that that's the complete opposite. It's not exactly what obtains. The other reason why women tend to die more is that they found out that the symptoms, the signs and symptoms that we generally see think as this person has a heart condition, are very different in women. So, for instance, if someone is having a heart attack, what's the first thing that comes to mind? You think the man begins to hold his chest, or the person begins to hold the left side of his chest, and it's like a tight, grinding feeling, and it's like obvious. The man breaks out in sweat, he's in pain, he's writhing on the floor. So you're like, yes, that's obviously having a heart attack. In women, that doesn't happen as regularly. In fact, it's rare. Usually what women see is like, oh, well, I have a slight discomfort. She's sweating more. She may just be tired, just unusually tired and fatigued. And yet, she may be having even a worse heart attack than the person who is grinding his chest and writhing on the floor. He may be having a much worse condition. So women have it worse, and they tend to die more because people don't recognize that they're having a heart attack. They don't recognize that they're having an issue going on. And so it's important, again, that we understand the signs and symptoms that obtain in women. In the next session, we're going to look at some of the signs that medical doctors are seeing in terms of how men's pattern of blockage, arterial blockage, is different from women's pattern of arterial blockage. We'll be right back.